A dangerous spike in the number of Legionnaires cases right here in Michigan is leading health experts to now sound the alarm about protecting yourself. 7 Action News reporter Simon Jacquet has the exclusive interview with a survivor, sharing his experience and what helped him avoid permanent injury.
A recent survivor of Legionnaire's disease admits he did not know much about the illness prior to testing positive, and he says he got the treatment he desperately needed just in time here at Beaumont Royal Oak.
It's your stamina, your strength. This thing eats you from the inside out.
Scott Larwood still isn't sure how he contracted Legionnaires, but one thing he does know is that he quickly learned just how terrifying it can be.
Not being able to take a deep breath and not being, like I said, literally fighting to speak. You know, it advanced so quickly with that within days is when I was hospitalized.
In July, he came to Beaumont Royal Oak, the Farmington Hills man finding himself relying on aid to help with things he's always done before with no problem.
I don't want to say I couldn't move, but I needed help, like to stand or to walk, to even do anything.
New reports show a nearly 600% spike in cases of Legionnaires across 25 counties in the Great Lakes state. Between July 1st and July 14th, 107 cases reported, according to the Michigan Department of Health and Human Services. Of those, 19 confirmed cases in Wayne County, 17 in Oakland, and 15 in Macomb. The state is warning Legionella bacteria can cause fever, cough, and pneumonia, along with other symptoms.
It can sometimes get into like shower heads and things like that. Water-cooled air conditioners, like the kinds that you can get that like hook up to a sink.
Dr. Matthew Sims is head of infectious disease research at Beaumont Health. His message is on par with state health experts warning about stagnant water and flooding creating a breeding ground for bacterial growth, and transmission to people occurring when mist or vapor is inhaled, but not from person-to-person contact.
The big way you get it is by inhaling the droplets. Large-scale air conditioning systems. It's worse when those air conditioning systems haven't been used for a while and the water's been stagnant.
Experts say higher risk groups include people over 50, current or former smokers, people with chronic lung disease, people with weakened immune systems from diseases such as cancer, diabetes, or liver or kidney failure, and people who take immunosuppressant drugs. For Scott, the experience of spending a week in the hospital has brought new perspective and reinforced the importance of listening to your body.
Having gone through this for the first time, what are you taking away from it?
If you don't feel well, get checked out. Don't just assume you know what's going on. I was pretty much told had I waited a few more days, my recovery, I may not have recovered or would have experienced some sort of permanent damage.
Health experts also agree another very important step is making sure you stay in regular contact with your healthcare provider. From Royal Oak, Simon Jacquet, 7 Action News.
Simon, thank you.